So, starting at the top of the cat, you have the clavobrachialis, okay, which I will tag from the front. There are some muscles that I can tag from the front or the back. It depends on what you can see. For example, the triceps brachii. Triceps brachii. It has two names. Use both names if I tag it, okay? Another thing, I could tag the triceps brachii on this cat here at station number 8, and I could also tag it over there at station number 3. Just because I tagged it in one place doesn't mean I don't automatically not tag it somewhere else. So don't let that freak you out if you happen to see the gastrocnemius tagged twice. It could happen, okay? So you have your triceps brachii, clavobrachialis, pectoralis major if I'm at the top of the chest, pectoralis minor if I'm on the lower part of the chest. That's it. Moving down, you have your external abdominal oblique, which is basically this muscle right here. Also a great dissection. Wish I could use this cat for everything, but I can't. And then, of course, this is external abdominal oblique. If I have it open and I have the muscle tag, internal abdominal oblique. Okay, moving down. On the lateral side of cat, this is the reason I love this cat. This is the absolute best tensor fascia lata I have. It is right there. Very clear, perfect tensor fascia lata. Okay, the tensor fascia lata, I could show you in this position. I could also see it really, really clearly from the posterior view. This is a fascia lata. This is a tensor fascia lata. It is named based on what it does. The tensor fascia lata tenses the fascia. Now, as you guys probably read somewhere, the fascia lata is over the vastus lateralis. And on this particular cat, it's not detached from the vastus lateralis. So you can't see the vastus lateralis really, really clearly. So it's a good chance I'll probably use a different cat for the vastus lateralis. Okay, that's assuming I do use this cat for the tensor fascia lata. Moving to the front of the cat, you have the superior. So when you're, if I'm tagging anything on the thigh, front or back, decide at first, is this superior or is it inferior or deeper muscles, okay? Sartorius gracilis, Sartorius gracilis. This is a skinny little puny, very lean cat. Who cares what his sartorius or his gracilis looks like? If you know where it is, you can identify it on any cat, okay? So make sure you're learning the position and the location of the muscles, not necessarily exactly what it looks like. So peeling the two back, you have the 4 deeper muscles. Now, I'm gonna tag the deeper muscles, if I do, on a cat where all 4 of them are kind of close together. This one has one of the muscles a little bit more detached, so it's a good chance I probably wouldn't use that. It will be attached, and they will be closer together. Okay, vastus medialis, adductor femoris, semimembranosus, and? Semimembranosus. Okay, so you know them in order. So you don't have to care what it looks like. If I tag the second muscle, you know what it is. Don't make the mistake of writing abductor femoris. You just ruined it because now that's a different muscle. It's ADD, adductor femoris, okay? So now you have the front deep part. What else can you see from the front of the cat? Well, you could see the gastrocnemius. I can pull the gastrocnemius back, and if I tag any muscle below it, what is it? The soleus. The soleus, okay? I can also tag the, Richard, that's so close to me. I'm sorry. Okay, so you also have the tibial nerve, okay? Now, you can have, there's only 2 nerves that I might tag. The brachial plexus, the axillary nerve is beautiful right here, but I'm not tagging it because it's not on the list. Tibial nerve, sciatic nerve. Those are the only 2 nerves you're responsible for. I could also see the Achilles tendon, and although it's not on that list, I like to have fun. Once in a while, I tag fun things, okay? So let's go on the inside. I'll need somebody to help me, somebody that has gloves at some point to hold this open when I go to do this. So starting at the top, you have the trachea. So I will pull it out like this if I'm going to tag it. Okay, you have your esophagus, which I will also pull out and tag if I'm going to tag it. Okay, moving down. Gloves, can you help me? Just kind of hold it open. Are you not a gloves person? Anybody who doesn't mind? Thank you, Philip. I appreciate your help.
So funny.
Just kind of hold this open, okay? All right. So here are the lungs. Guys, I am not going to have you identify any of the lobes of the lungs. So if I tag any one of the lobes of the lungs, don't call me over and say, do I have to tell you what lobe it is? No, just tell me it's the lungs. I also like to tag the heart once in a while, especially if I feel like the class is weak, because that's an easy one and nobody misses it. Diaphragm muscle, guys, diaphragm. Say things like they sound for the spelling. That's how I learned how to spell all these anatomical terms, is I would say it in my head the way it sounded for writing it. Diaphragm. Okay, so that's your diaphragm muscle. Then the liver. I'm not going to ask you to tell me the lobes of the liver. If I tag the liver, it's the liver. It doesn't matter which lobe I tag. This is the gallbladder. Guys, there are 2 bladders in the body. Don't you dare write bladder. Gallbladder or urinary bladder. Okay, If I tag the gallbladder, it's probably going to be a green one just like this one. It's probably going to be from the top. I'm not going to pull the liver up and open to tag it from the bottom. It will be tagged from the top. Moving down, you have your stomach and your spleen. Stomach and spleen are on the left. The spleen is underneath the stomach. Okay? This is not the type of spleen I will tag. I will probably tag one of the spleens that's larger and darker that comes across. Okay? Then you're looking at the mesentery or greater omentum. I did not have you tag the lesser omentum, even though there is one. So if I'm going to do the greater or less omentum or the mesentery, I'll probably open it up to where you can clearly see that that's what I'm looking at. Okay? Moving that up, you have the small intestines. You're good. You can relax your hands there. Now we have the small intestine. No matter where I tag this thing, it's the small intestine. If I'm going to tag the large intestine, I'm going to move this out of the way, and there's your large intestine. You can call it the large intestine or you can call it the colon. It's still correct. I will also move things out of the way if I'm going to tag the kidneys. One of the kidneys or kidney. And or the ureter. This is a ureter. Make sure you know it. I will not tag the uterus. So make sure you know how to spell ureter, just in case I tag it. And then, of course, you have your urinary bladder. There's two fat pads on either side of the urinary bladder. I will not tag those. Okay. I will not tag the pancreas, and I will not tag the thymus gland. Did I miss anything? Okay. No, right? The stomach is right here, right under the liver. Okay, can you turn it over or help me turn it over? Just put her face down, or him. I think it's
This
him.
video is almost 10 minutes long, but
It's going to be 12.
It's good.
All right, here we go. So, starting at the top of the cat, do the exact same thing as before. What can you see at the top, and then move down. Okay, so once again, you can see the triceps brachii from the front or the back. I could tag it from either side, guys. I could tag it twice if I wanted to. Okay, the first thing that the pin is going through is what you are going to name. So if I tag this, it is going to be the acromia trapezius, because this is the acromia trapezius. Don't all call me over and say, is it this one or the one underneath? The first thing the pin is going through is what you are going to label. If I want to tag the supraspinatus, I will pull this back and I will tag the supraspinatus. Moving down, look at this beautiful latissimus dorsi. Excellent dissection here. Now, like I said, I can't use this cat for everything, okay? But I will tag one, if I do tag it, that's going to have this visible, clear angle that the latissimus dorsi is. This is a lumbodorsal or lumbosacral fascia. Lumbosacral down here, lumbodorsal up here. I will not have you distinguish between the two. If I tag this fascia, you're just going to call it one or the other, lumbosacral or lumbodorsal fascia. Okay, moving down, I think I covered everything up there. Moving down, you have your biceps femoris. Biceps femoris, guys, there's two biceps. The cat has two biceps too. I didn't make you responsible for the biceps brachii, but it has two biceps. So make sure you're using first and last name. Now I could tag it like this, or I could peel it back, pin it, and tag it here. It's still the biceps femoris, okay? So we have this back, okay? And then, of course, you have four muscles underneath. These are nice and organized. Now, remember, here you have your vastus lateralis being covered by the fascia lata. Here's a nice little tensor fascia lata. Notice how clear and beautiful you could see it from the back of this picture. So I could tag the fascia lata and or the tensor fascia lata from the side or from the posterior view. So, since this vastus lateralis is pretty much covered by the fascia lata, it's a good chance I wouldn't use this cat for the vastus lateralis. Okay, but the first muscle, know them in order. Once again, vastus lateralis, adductor femoris, semimembranosus, semitendinosus. Doesn't matter what they look like. You know them in order. First muscle, second muscle, third muscle, fourth. Okay, if I tag the fourth one, you know it's the semitendinosus. What else can you see from the back? The sciatic nerve. Okay, sciatic. Gastrocnemius. The muscle underneath it would be the soleus. It's hard to see the tibial nerve from the back. Usually if I get to tag the tibial nerve, it'll be from the front, but it doesn't mean I can't. Tibialis anterior is beautiful right here. Guys, the tibialis anterior is an anterior muscle, but I could still see it really nicely from the back. So I could tag it from either side. And just to have fun, there's the Achilles tendon and there's the tail, just to have fun. Did I get it all? Mm-hmm. All right, y'all.